parties were organized by universities across the country, including one that spontaneously got organized at San Diego, at UCSD, and they got an ode to our country and we're watching right now, so special shout out to San Diego. What we'd like to do now is give you a quick orientation as to what the Health Day Initiative is all about. Let's pick the right device here. Very simply, the Health Day Initiative is a major effort to turn HHS and our sister agencies into the NOAA of health data. As you may know, NOAA, the National Oceanic and Atmospheric Administration, collects a huge amount of weather data and then publishes this data online in machinable format, downloadable by anybody for free, without intellectual property constraint. That data is then actually taken up by a ton of innovators in the private sector and outside NOAA, who then use it as fuel to power an amazing array of useful products and services that generate huge social and economic value, like weather newscasts, weather websites, mobile apps, weather insurance, and more. The government went similar play in the 80s when it opened up GPS data, which famously spurred a ton of products of innovation as well. And so the Health Data Initiative is just our latest attempt to essentially run the same kind of open up the data and fuel innovation play, this time with health-related data. The vast treasure troves of health-related data in the vaults of HHS and other agencies. And the vision is to stimulate a rising tide of innovation across the country, grassroots, decentralized, self-propelled, fantastic, that leverages our health data as fuel to help improve health and healthcare in America. So that's really the gist of it. The brass tacks core activities of the Health Data Initiative are to liberate data, liberacion, and to catalyze innovation. That's not a word? Innovation. And so basically, 1, 2, 3, 1, we're publishing brand new HHS data for public access. 2, very importantly, we're making existing public HHS data a whole hell of a lot easier to access and use, making it machine readable, downloadable, accessible via APIs, application programming interfaces, which are the way the developers do like to roll with data, making it free as much as possible, making it much easier to find, as opposed to buried in some obscure web page or publication somewhere where nobody knows about it. And then finally, equally if not more importantly, we are energetically publicizing this data to innovators across the country. Innovators who actually, in a lot of cases, don't even know we have this data, let alone that it's available for them to use. These innovators can then use this data as raw material to dream up and create new applications and services to help improve health and healthcare and create jobs in the future at the same time. So you may ask, what kinds of data are we talking about here? What kinds of data are being liberated? So I'm just going to give you a few examples. It would be impossible to go through all, but just a few examples to give you a sense of the gestalt of the data, as it were. So we're liberating community health data. As an example, we launched something called the Health Indicators Warehouse this past February at healthindicators.gov. Contains over 1,100 metrics of community health and healthcare performance, smoking rates, obesity rates, access to healthy food, air quality, hospital readmissions by condition, Medicare population. Includes a ton of Medicare data, never previously published. And actually is accessible both via download and via an API to make it super easy to use. We're liberating provider directory and quality data. So examples include nationwide directories of healthcare providers and service providers. Think of it as location-based data on the nation's health infrastructure. Another example, hospital, nursing home, dialysis center, home health quality data, institution by institution, available through Compare, a very popular data set we're finding. And just this September, Medicare launched APIs to this data to make it much easier to use at data.medicare.gov. A third example, there are many examples along these lines, thanks to the Affordable Care Act, the healthcare law passed last year, Medicare is now authorized to make claim files available starting January 2012 to any qualified public or private entity that will then mash up that data with other data to deliver quality reports about providers across the country. Very, very, very powerful and a real victory for data liberacion. We're liberating blue button data. You hear a lot more about this from Master Peter Levin from the VA later this morning. But in short, it's a joint venture of the VA, HHS, and DoD that quite simply allows veterans, 47 million Medicare beneficiaries, millions of members of the military to download their own data, their own claims. So easily, at no cost, they can actually do whatever they want with it and bring wherever they want. As launched October of last year, it's getting a lot of traction, as Peter will talk about. We're liberating consumer product information. So as an example of that, FDA recall data on drugs, devices, and food was made available by FDA in October. Downloadable XML format for the first time, which makes it, again, a lot easier for developers to use. We're liberating medical and scientific knowledge. The National Library of Medicine, as Dr. Collins mentioned, has been doing open data since before open data was cool. And they keep amping up the level of their game. In September, they launched something called the API Portal, which is inventory of all their super powerful APIs for developers to use to do good and build value in the world, including clinicaltrials.gov. It's amazing, continually updated inventory of like every clinical trial in America and in many countries around the world. Pillbox, a super cool API that has structured information about a lot of different kinds of drugs and will soon include high-quality resolution, high-resolution images of those pills and tablets. Midland Plus Connect, another super cool resource, basically a new service that launched in November of last year that delivers customized packages of patient education content to electronic health records and personal health records, customized for the medications, diagnosis, situation of a given patient. Super awesome. Again, free, without intellectual property constraint. We're liberating government spending data. So actually, to fulfill a long-standing dream of Bob Kocher, we finished publishing in May a whole series of Medicare claims basic standalone files. These are the first ever Medicare claim level files that are available for free public download. Now we actually have to slim them down quite significantly to make sure we didn't violate privacy, because that's our dominant consideration here. We have to make sure we protect privacy above all else. But there's still a lot of useful data in there. Bob is going to go to town on that stuff as well as other people. So we're excited about that. We also, because this is like hard to keep in your head, in terms of where all this stuff is, we launched a community on the data.gov site called healthdata.gov in February, which is a one-stop shop to get all of our free data. So check it out, tell us what you think, and keep an eye on it because it's adding more and more data all the time. And equally, if not more importantly, we're engaged in an aggressive, energetic campaign to publicize our data to innovators across the country. So if you publish data that nobody knows about, ain't going to do any good whatsoever, right? And again, many, many innovators across the country have no idea we even have this data, let alone the fact it's now available to them. So we've been engaging in a huge amount of activity here with our great partner, Health 2.0, who's in the audience. We've been participating in, triggering, catalyzing, being part of challenges and codathons, public competitions to build the best apps. Codathons are basically innovation bake-offs. People get together to build stuff over the course of a weekend. This picture actually is Team Maya from Pittsburgh that came to the Georgetown Codathon in February, won it with an ingenious idea called Food Oasis, and they're here this morning to show it to all of you. We've also been engaged in a lot of innovator meetups and conferences. If anyone out here wants to organize a meetup, talk about health data, I am there. Just tell me, and I will show up with bells on to talk about health data. Annual health data palooza like today. But a lot of activity, a lot of outreach to educate the world of innovation about what is out there in terms of data and what they could potentially do. And the goal of all this is to catalyze the development of an ecosystem. The deliverable isn't just data out there. It's not even a particular set of applications or services. It's an ecosystem. That's the deliverable. To create a self-propelled, open, decentralized ecosystem of innovation that leverages data to improve health. And in this ecosystem, we are just one of many suppliers of open health data, growing sets of data that then fuels a growing arsenal of innovators across America and the world that create innovative products and services that harness the data to do a lot of incredibly useful things, like help consumers take control of their own health and healthcare, helping them find the right care provider for them, helping them find healthy food in a food desert, helping them find a clinical trial that could save their life, helping them get the latest and greatest health information from the National Library of Medicine right when they need it, where they need it, helping employers promote health and wellness by providing super cool tools like those to their employees, helping care providers deliver better care, helping them find the right care partners and communicate securely with them to ensure that the patient gets what they need, helping to augment the analytics that are required to help providers keep people healthy in a proactive way, which both improves health and lowers costs, and which, thanks to the Pay for Health, Pay for Quality reforms of the Affordable Care Act, will actually financially generate significant boons for providers on a go-forward basis. Helping journalists identify key health issues, shed light, put pressure on communities and decision makers and policy leaders to do something about these issues, helping those leaders make those right decisions and inform the right kinds of actions, supporting innovators who are doing all the above through data intermediary services that make it easier to build apps and products and services and do all this stuff, and much more. And it's a really important point for us to stress is that this ecosystem isn't meant to be owned or managed centrally by anybody. It's meant to be highly decentralized, grassroots driven, self-propelled, as all truly great innovation ecosystems are. inventing and delivering solutions that no one organization, no 10 organizations, as Secretary said, could possibly have even dreamed up, let alone provided to the American people. And so while it's still very, very early in the development of this ecosystem, today you'll have the unparalleled opportunity to see what nearly 50 leading companies and organizations have been able to pull off, incorporating health data into their products and services, and new products and services in ways that are both subtle and powerful, ingenious and disarmingly straightforward, in a classic display of the power of American innovation. And on top of the solutions you'll see, you'll hear about a dozen major announcements by additional companies and organizations. They'll be issuing new challenges and other big action beats, which are very, very exciting. So let's actually talk about the structure of the rest of the day. So you're about to hear from 10 super cool solution generators and inventors in presentations this morning, as well as a sequence of very exciting major announcements and action beats. Then, after a brief lunch, there's going to be a series of concurrent tracks in the afternoon. A data and apps expo in the atrium that has 48 solution exhibits, and then 27 deeper dive solution presentations happening in balconies A, B, and C simultaneously. And then deep dive panel discussions on topics ranging from privacy to data-driven journalism to health data in an era of accountable care and many more exciting topics. And then we'll all get back together again here for a closing session with major announcements and action beats, panel discussion reflecting on the day with Anish Chopra, Tim O'Reilly, coach Rick Foster, and then presentation of Best in Show Awards that you'll hear more about in just a second. So today is just a day of massive celebration for what health innovators have done. Both innovators inside the government who have liberated key data sets, many of whom are here today, and innovators across America taking this data and turned it into incredible capabilities that can benefit the American people and create jobs in the future along the way. And today's also actually, in addition to being a celebration, it's a challenge. It's a challenge to these innovators, to all of us, to innovators across the country, to build on what they've done, to keep propelling this amazing ecosystem of innovation forward and deliver more and more progress for the American people. So I couldn't be more thrilled to welcome you here today. Thanks so much for coming to hang out and to talk about health data for a day. God bless you. May the force continue to be with us. And we'll let the show begin.